So today we're actually going to talk about some other brain disorders. Some of these have actually started to fall under the dementia umbrella. You hear us speak about the dementia umbrella, that dementia is not the disease. There's different types of dementia, and we've gone over the most common ones, but there's over 130 different types or kinds of dementia. If you missed any of the programs that we've done over the last several weeks, they are on our James L. West YouTube page. You can go and find them there. You can always shoot me an email or shoot Jamie an email and we'll send it to you as well. So we went over Alzheimer's disease, which is the most common type of dementia. We've done vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson's disease dementia. Last week, Jamie went over some of the ones that we don't see as often, different types of dementias. And then today we're finishing up this series with understanding other brain disorders. We're going to talk about 10 brain disorders that can cause dementia or that can mimic dementia and have dementia-like symptoms. We're going to talk about the causes, the risk factors, the diagnosis, the treatment, and in some cases, there's actually some prevention that we can do. And the first one we're going to talk about is ALS. And you may know this better as Lou Gehrig's disease. It has been moved over. Sometimes this will fall under that dementia umbrella, but the part of the brain that's affected with ALS is the part of the brain that controls voluntary movements, and they just become progressively weaker as time passes. It eventually does lead to paralysis and death. There is not a cure. Like with many of our brain diseases, there's no cure, and it has about a 5-year life expectancy. You may be thinking, though, of someone that we're going to talk about in just a minute that actually lived 55 years with ALS. But I was looking this morning about reasons why did he live 55 years and most everybody else lives about 5. So we'll look at that in just a minute. Occasionally, and this isn't very often, but occasionally people with ALS will develop the type of dementia that's called frontal lobe dementia. And the reason they develop frontal lobe dementia is because they start having a destruction of the brain cells up here in the frontal lobe. And typically what will happen is as they're progressing through their ALS, their care partners may start seeing a change in personality. They may start seeing changes in behavior that's very unlike them, emotions, flat affect, things that don't necessarily go along with ALS will start showing up. A loss of inhibition, social inappropriateness, that is not part of ALS. So if they start having these type things, the mood swings, some memory loss, because memory loss does tend to come later with frontal lobe dementia. But if they start having signs of memory loss, loss of speech, loss of reasoning, repetitive type things, people with frontal lobe will often gorge to the point that they'll make themselves sick overeating. Then they may have developed ALS with frontal lobe dementia. It is rare, and it typically is in people 55 to 65. They can see it though. Diagnosis for ALS with dementia, they can do a CAT scan or an MRI, and what they see is brain atrophy up in the frontal lobe, which does not go along with ALS. So if they already have ALS and then they do these scans and they see some brain atrophy, then they know that they have developed ALS with dementia. And of course, I was talking about Stephen Hawking. So Stephen Hawking lived for 55 years with ALS, and most people live 3 to 7. He had access, though, to exclusive nursing care and medical care. He also was diagnosed at 21. And what I found with ALS is that the earlier somebody is diagnosed, they tend to live longer, but they don't know why. So getting diagnosed at such a young age, and then of course he had access to things that your regular person wouldn't have access to. He was able to do some experimental kind of things, and he did. And he lived for 55 years with ALS. So ALS, they can then develop frontal lobe dementia. The next one is depression. And we've got an entire series that we do on depression and dementia. It's really interesting, the link that they're finding between depression and dementia. You can see there, and again, you're going to get these. Depression changes the brain. Depression that is chronic and long-term actually changes the brain, and it changes the blood flow up in the frontal cortex, and you can see it in those pictures with chronic untreated depression. They're actually finding a link between untreated depression and dementia. And there's a study that was done, that first bullet point there, that shows that early onset childhood depression and late onset, this is somebody who's over the age of 60 who's never really had much depression before, are the most likely to develop dementia later in life. Now, we're all going to have that situational depression that comes with just being alive. We're going to have situational depression. That is not what we're talking about. We're talking about chronic, like a major depressive disorder. Reoccurring depression is also linked to vascular dementia because of the changes that take place in the brain. And then anxiety kind of gets put in there with depression. Those damage the brain because the chemicals are changing in the brain. And we see changes in the hippocampus. And of course, the hippocampus is the memory center of the brain. Another area that's damaged by depression is that conflict resolution center of the brain and the prefrontal cortex. And all of that's associated with planning and executive function. So if somebody has depression and they're starting to have issues with planning and executive function and conflict resolution, those type things, those can be some of the first signs that this may now be developing into dementia. There is treatment for depression, though. Most all depressions can be treated. I believe, if I'm remembering right, the number was that about 90% of depression can be treated, and even the other 10%, you can help relieve the symptoms. So treatment includes antidepressants, establishing a routine of pleasurable activities, staying active, and lots of times doing some type of a therapy, a cognitive behavior therapy. So many times when we hear that word depression, we think of sad. But again, in that program that we've got on depression versus dementia, we talk about that you can be depressed and not be sad at all. Because take a look at this picture here. These are some really depressed people. You may notice some of these faces on here. I don't know that many of us would have ever looked at Robin Williams and gone, well, he's sad, or Chris Farley is sad. Whitney Houston's on there, Kurt Cobain. There's lots of faces you may recognize on there. Those are the faces of depression. So depression is very, very serious, and it does change the brain chemicals, and it can mimic, or we now know can even become dementia. The next one I want to talk about is Lyme disease. So Lyme disease is exactly the one that you're thinking of, where you may be going, I had no idea that that could be linked, but Lyme disease is the illness that's spread to humans through the bite of a tick that's infected with a particular type of bacteria. And that bacteria can cause, I'm not even going to attempt to pronounce that, it's there at that first bullet point, and that then can lead to Alzheimer's disease specifically. We know it's Alzheimer's disease because of the plaque that they can see. And I've got a picture of an MRI up here, so you can see what the doctors can see. Might not mean anything to us, but you can actually see it there. It's actually very rare. It happens in less than 2% of all cases of people who do develop Lyme disease. If you look at that third bullet point, the dementia-like symptoms that come with Lyme disease, if they develop it, are curable. Because what you typically will see is a progressive cognitive decline. And we know in dementia, it doesn't happen just overnight. The only dementia that really comes on suddenly is vascular dementia because of strokes. But things like Alzheimer's disease, that's over the course of many, many, many years. So with Lyme disease, though, it can happen like in the course of a week or two. They may start to lose weight, start having gait issues with their walking, and develop a tremor. but they can be given antibiotics and recover rapidly. So sometimes you'll hear them call this a reversible dementia, and people will get the idea that that means all dementias are reversible, and we know that's not the case. Progressive terminal dementias like Alzheimer's, frontal FTD, Lewy body, those are not reversible. So this is just Lyme disease has some dementia-like symptoms that can be reversed. And it's actually named Lyme-induced dementia because it can be reversed. They have a very rapid decline, like I said, and they actually get a scan that's called an MRS scan. And that's what this picture is of right here. It's where they can see it. And then I also, this next slide, you can actually see what Lyme disease looks like, how it changes on the skin. That first picture is just kind of how it starts. You can see the bite there from the tick, and then it develops this rash, and it can actually go all over the body. The next one we're going to talk about, and I'll put these two together because it's malnutrition and vitamin deficiency. This is why at the first sign that we think that our loved one may be starting to show signs or symptoms of any type of dementia, we want to get into our primary care physician and have a complete checkup with blood work done. Because somebody who is malnourished or has a vitamin deficiency can actually have symptoms of dementia. So the definition of malnutrition is when a person's diet doesn't provide enough nutrients or the right balance of nutrients for their optimal health. Now, this is something interesting you might not have known. It's possible to be obese and be malnourished. So you can be overweight, but because of the kind of diet that we're eating, we still fall under, because people tend to think that somebody who's malnourished is very, very, very skinny, and you can be obese and be malnourished because you don't have the right nutrients. And it's those nutrients that can cause us to kind of have that brain fog. Some of the symptoms of malnutrition, and I'm going to give you a complete list on the next slide, and again, you'll get copies of these. Thin skin, hollowed cheeks, starting to lose hair, irritability, and there is lack of concentration, muscle wasting, and here's depression. So the causes of this, sometimes it's a mental health issue. Sometimes it's a digestive disorder. They may have irritable bowel syndrome. They may have Crohn's disease. They may have something where they're not being able, a person can get diagnosed with malnutrition after they've had a bariatric surgery, gastric bypass, or the sleeve because they're not absorbing nutrients. Alcoholism, we see this a lot. People who are chronic alcoholics and then they're not absorbing their vitamins and minerals. Or having mobility issues, a person can become malnourished. So risk factors. The biggest risk factor when you look at malnutrition, the first thing that pops up over and over again is older adults who are isolated and have other health issues and or mobility issues. And so it changes the way they eat. They may not be eating foods where they are getting enough of their vitamin and nutrients. And so they may start having signs and symptoms of dementia. This is easily diagnosed with blood tests. They look specifically for iron, nutrients, vitamins, and then there's treatments. You can start taking supplements, you change your diet, you treat other infections that may be part of this cause. I did want to share this next one, and this has a lot of information on it. So again, you're going to get these. These are signs of nutritional issues, and you can see there, it's with our nails, our skin, mouth, gums, skin of the face, eyes, throat, and legs. So there's lots of information on here. And again, this is reversible. They can even do infusions for people who have vitamin deficiencies, and it's almost like a fog list, and they become clear again. This is another one, medication interactions. You may have heard that term polypharmacy, and that is when we're using 5 or more medications daily. This isn't just prescription meds. Think about how many pills you take every day, including your supplements, including your over-the-counter, and including your prescription medications. How many are you taking? It can affect our ability to think clearly. It can affect our ability to remember, or to make appropriate decisions. This is another reason why when somebody is starting to have some memory issues or other symptoms or signs of dementia, that we want to make sure we get to the doctor, that we're very honest with all of the supplements, all of the over-the-counter medications, everything that we're taking, because it could just be a medication interaction that could be changed. Now look at these numbers. I pulled these yesterday. This was from the Journal of Clinical Geriatrics. Cognitive impairment was present in 22% of the people who were taking 5 or fewer medications. 22%. 33% of the people, excuse me, who were taking 6 to 9 medications had a cognitive impairment. And then look at this huge number. 54% of people who were taking 10 or more medications. Now, again, that's all medications, supplements, over-the-counter, and prescription. 54% were showing some type of a cognitive impairment. That's a big number. We may not even be realizing it in ourselves. It is worth making sure that our doctor takes a look at, or our pharmacist. Pharmacies will do this for you as well. There are some high-risk drugs, and I've got them in bold print on the 3rd bullet point, those muscle relaxers, which are used to treat all kinds of things. Even the medication to treat overactive bladder is considered a muscle relaxer, and it can contribute to cognitive impairment. Psychotropic meds that affect our behavior, our moods, or our thoughts. These are the meds right now that so many, the numbers are just up since the pandemic for anti-anxieties and antidepressants, antipsychotics, mood stabilizers, and even stimulants. That's where we've just got to be. There's nothing wrong with taking these. Sometimes we need them. It's usually temporary, but they can interact with other medications. Analgesics can actually cause cognitive impairment, and this is our pain relief. It can be an opioid, or it doesn't. It's not always an opioid, and many times this is used for pain and for arthritis. And then sedatives that are used to treat sleep can actually cause cognitive impairment. That is reversible. So what we want to make sure and do, the reason this happens, what I found, the reason this happens is we go to several different doctors. We used to, most of us can remember when we went to the primary care physician and they took care of everything. They even did minor surgeries in the office. Well, that doesn't happen anymore. They send you out to the specialist for everything. So we're going to the dermatologist, we're going to the gastroenterologist, we're going to the neurologist, and if we're not taking them a complete list of all of our medications, that's where we end up on all these medications. And so many times we start having a side effect from one and they'll prescribe a medication for that side effect. Now there's another medication. So we've just really got to be careful with medication interactions. The next one that we're going to look at is multiple sclerosis. Multiple sclerosis has moved under the dementia umbrella in the last several years. You can now find it listed under the dementia umbrella because the number is now up to 22% of those with MS will eventually develop dementia. So what is MS? It's an autoimmune disease. It affects the part of the brain and the spinal cord that controls the central nervous system. There's not a cure. It can be as young as 18. It's typically between 18 and 55. It is more common in females, although males can develop it. It's more common in females. They have for the most part, they have a near normal life expectancy, but they typically pass away from complications due to progression of the disease. But they still, for the most part, do have a normal life expectancy. They actually start to have lesions on their brain. And I'm going to show you a scan in just a minute so you can see what that lesion looks like. And they continue to grow on the brain throughout the course of the disease. So in this graphic that's on this particular slide, it shows the cognitive impairment that can show up in someone with multiple sclerosis. Again, 22% of the time, so that doesn't mean everybody, but they can start to have some short-term memory issues, problems with abstract thinking, attention deficits, and then slow processing. So that's how it shows up there. So you wouldn't want to look at that list of those 35 or 36 common symptoms for dementia and think that somebody with MS is going to develop that. It's really these four are the ones that they tend to have. So here is a picture of a scan where you can actually see the lesions on the brain. And this is a person who has multiple sclerosis. So you can see how easily it is for the physicians to see this. The next one we want to talk about is seizures. And we get asked about this a lot because many times a person who has Alzheimer's, Lewy body, frontal temporal, Parkinson's dementia, any of the other dementias will start to have seizures. So I want us to think about, well, why would that happen? On the fourth bullet point, seizures are actually a symptom of dementia because families, their loved one has been diagnosed with dementia and they may start to have seizures and they get very concerned, why are they? Well, think about what's happening. This picture that's in the background is perfect for this because anything that changes the structure of the brain can cause seizures. That makes sense. In Alzheimer's disease, we've got proteins and plaques that are building up on the nerve cells, and it makes those nerve cells become hyper. They become hyper-excitable, which means that they're out of control, which can cause, it's almost like a storm in the brain, and it can then cause a seizure. So anytime somebody is having a seizure, you'll hear the word epilepsy and seizure kind of used interchangeably, but it can affect any area of the brain. It just depends on where the seizure takes place. It can be genetic. It can be caused from a trauma, from a traumatic brain injury. A person can have a seizure because of a stroke, because of tumors, because of meningitis. There's all kinds of reasons. A person having a very, very high fever can have a seizure. Found this yesterday as well. Scientific American conducted a study and found that silent seizures may cause Alzheimer's disease. There's a lot of research going into this right now. They're petit mal seizures. They're the ones that are non-convulsive seizures. Lots of times the person will just look like they're staring off for just a moment and they'll come back and they're actually having a seizure during that time. I know whenever I was a school teacher, I had students who would have those type of seizures where it's like they've just kind of spaced out for a moment and then they're back and they're actually having seizures. They found treatment with anti-seizure medication in epilepsy patients lowered the risk for Alzheimer's disease as compared to those who didn't receive the medication. So again, there's a lot of research going into this because they're looking into, could this actually be the cause of why some people develop Alzheimer's and they're having seizures that they don't even know that they're having. They're having those little petit mal seizures. So they do use anti-seizure medications and they tend to be very successful in reducing and in some cases can even stop seizures. So here are signs and symptoms of a seizure. Confusion, they could fall, that staring, like I mentioned earlier, uncontrollable jerking movement, strange sensations. Most people, when they hear seizure, they think of, like what we've seen on TV or the movies. And of course that does happen. But we also have those that you're not even aware, they're not even aware that it's happening. The next one we want to talk about is stress. And this is another one that we've got an entire program on stress and dementia because of what it does to our brain. Stress makes us produce that hormone cortisol. It also makes us produce adrenaline. And those have been linked with memory problems. Stress is also linked to depression. There's our friend depression coming back in, and anxiety. We can have that pounding heart. We start to sweat. We get tense. We're irritable. It's there for a reason. It's there so that we have that fight, flight, freeze, so that we will react to something. But sometimes we get to the point that we're living at that state. The Alzheimer's Society found a link between those with PTSD and long-term stress developing later in life. That's another big research project that's going on. Why are we seeing so much dementia in veterans who have post-traumatic stress disorder? Is it because that those chemicals in the brain changed to the point that they then started to grow the plaque. They're finding these links now in their research. The next one, this was a study that was done in Denmark. It was a long-term study. And of the people in the study, 1 in 5 people who had had decades of stress in their life later developed dementia. What was interesting is what they considered decades of stress were people like emergency room workers, police officers, first responders, those whose stress is part of their job every day. And then they were later developing dementia. So prevention of stress. When we figure that out, there's the $1 million question right there. But managing and balancing our responsibilities, making sure we eat healthy. We know to do these things, but are we doing them? Regular productive sleep and exercise. So the treatment then for stress is that those lifestyle changes, counseling, and relaxation techniques. This again is another slide. You will get this. I know that's hard to read, but I wanted to have on there what stress does to the body. It affects from head to toe, it affects us. We really can start to have a lot of IBS, irritable bowel syndrome with stress. And we are right at time. Let me get to these last couple real quick. So stroke. Whenever we did vascular dementia, we talked a lot about stroke because we know that vascular dementia is usually caused by TIAs, little strokes. And what happens in a stroke? That is when the supply of blood carrying oxygen to the brain is suddenly cut off. So vascular dementia is most often, it's caused by strokes, but not everyone who has a stroke will develop dementia. So keep that in mind. Now, another thing that we get asked all the time is, but my mom had a stroke and she didn't, or my brother had a stroke and he reacted. It depends on where the stroke is in the brain. This brain is big and it's got lots of different areas to it. So it depends on what part of the brain is affected and the extent of the damage. Because a person can have, I know someone in her 30s who had had so many TIAs, the little pinpoint strokes, they could see them on the MRI. She didn't appear to be having any issues yet, but what's going to happen down the road? What kind of damage was done to her brain? So for a diagnosis, they do a physical exam. There's a blood test, a CT scan, an MRI, an ultrasound to actually check the flow of blood. Prevention, we know again, this is keeping our blood pressure under control, avoiding smoking. Smoking is one of the biggest risk factors with having a stroke. Alcohol, illicit drugs, diabetes also falls in here, and stroke again tends to lead to vascular dementia. There is treatment for stroke. There's medications, there's surgeries. Sometimes they'll go in and put in stents, do an angioplasty. They can clip aneurysms, nutrition. I did want to show you a picture real quick of what stroke looks like on the brain. You can easily see there these white sections. This is where the stroke has taken place. These are 4 different people who've had strokes. So you could see where those 4 people would have different reactions because it's in different part of the brain. And the last one I want to talk about just real quick is thyroid disorders. And again, many times we don't relate a thyroid disorder to something that's going on in our brain. But think about what that thyroid gland is doing. It affects everything. It helps regulate our heart rate, our blood pressure, our body temperature, the rate at which we metabolize food. Thyroid hormones are actually essential to function of every single cell in the body. There's hypothyroidism, where we have a decreased production, and there's hyperthyroidism, where we have overproduction. Both of them can cause cognitive problems, and they can mimic the symptoms of dementia. And our thyroid, if you are someone who is on a thyroid medication, if your weight changes even as little as 5 to 10 pounds, many times you have to have your thyroid medication adjusted so that you don't start having some of that brain fog. Difficulty in concentrating is the first way that it tends to show up. Changes in your executive functioning, having a slow reaction time. These are also easily diagnosed with a physical exam, a blood test, or an ultrasound. And then it's treated with oral medication, radioactive iodine sometime, or a surgery. My brother actually in his 20s developed hyperthyroidism, which is actually pretty rare for a male, to the point that we really he looked very, very sick. He lost so much weight. He was just skin and bones. And he had ended up having to have surgery. I was telling Jamie earlier, he proudly shows where he had his throat cut. He shows that, but he's on medication for the rest of his life. But that's the thing with thyroid is you can control this. You can treat it. Thyroid disorders, this is huge, that are treated have not been found to lead to dementia. And I see we've got a few questions. Let me stop sharing. Our information is there. And again, you will get these. I know a lot of people are having internet issues today. Seizure disorders develop dementia. Yes. So someone who suffers from a seizure disorder can develop dementia. Yes, they can, just because of the damage that's going on in the brain. And usually that's another one that will show up as like a vascular dementia because of the damage. We appreciate all of you being here. If you think of any questions that you've got, you can email us that last slide and you'll get this entire program has mine and Jamie's information on there. You can give us a call or you can email us. And we appreciate you being here today. Thank you for your time.
Thank you.